Good afternoon. You're listening to a live Tele-Town hall meeting with your state senator, Dale Zorn. We apologize for getting started a little late today. We'll be talking about COVID-19 and the state and the local response. We're joined by hundreds of area residents this afternoon, and the ground rules here are simple. If you would like to ask a question of Senator Dale Zorn or his guest, Dr. Steve Bell, all you need to do is press 0. Again, if you'd like to ask a question and join the conversation with Senator Zorn and Dr. Steve Bell, all you need to do is press 0. Senator Zorn, you're here to answer questions, to share some information, and obviously there are a lot of questions out there. As we get underway this afternoon, Senator, what are some of the things that you're hearing?
Well, I'd like to thank everyone for dialing in this afternoon, especially on this Good Friday, working into Easter. Yesterday, as you know, the governor has enacted yet another executive order with many changes on it. Some are the same as they have been, but the governor has certainly extended the rules, the regulations, and policies. I'd like to thank all of our Michigan families. You've done a great job in adjusting to life under these extraordinary circumstances. You all deserve to get back to work as quickly as possible, and your lives begin to normalize. I believe the governor will be coming out with more orders, and we will have to look at them as they come. But the Senate itself is now looking at how we reopen Michigan and get people back to work. And I think that is so important that we can do that and still protect ourselves from the virus. So with me today is Dr. Stephen Bell from Newport Internal Medicine, and I'd like to welcome him today.
Thank you very much, Senator Zorn. It's an honor to be able to serve and help our community in any way I can.
Thank you.
Doctor, thank you again. If you would like to join the conversation and ask a question, all you need to do is press 0 as our live Tele-Town hall meeting with Senator Dale Zorn and his guest, Dr. Stephen Bell, gets underway. Again, if you would like to ask a question, press 0. And Senator Zorn, Dr. Bell, right now we're going to go to a question coming in from Florine in Frenchtown Township. Hello,
yes.
Florine. Thank you for joining our Tele-Town hall.
Dale, what are you able to do for the seniors that don't belong to a senior center? They may be out there and they don't know where to go. Yes, I know we have the Commission on Aging and that, but we've never had anything like this before, which I know you're well aware of. And I just don't want to see somebody go without food or without any medical needs or anything else. And I know this is a difficult time.
Thanks, Florine, for your call, and it's good to talk to you. Good to hear from you.
Yeah, I've been following you.
There is some things that seniors can do if they need help. First and foremost, if it's a medical issue or something is dangerous going on in their homes, make sure they call 911. But you can certainly contact our county resources, such as the Commission on Aging. You can take and call other health facilities, such as Monroe County Health. I think that's the biggest concern is the health. But there's a number that you can call on the state side that can provide information for seniors. And if I can just give you that number, it's 888-535-6136.
Okay, have it, Dale. Thanks.
You're welcome. Best to you, Florine.
And same to you.
Florine, thank you very much for your call. Right now, let's go to Gary, who is calling in with a question from Ottawa Lake. And it's possible Dr. Bell might be able to provide some answers here, too. Gary, hello, and thank you for joining our Tele-Town Hall.
Well, hello, Senator. Thank you, and thank you, Doctor. And we all out here appreciate everything you're both doing and all your peers across the country. You know, this is a comment and a question. We've been listening to the President's Task Force every day, 5 o'clock or whenever it is, and we've heard a lot about hydroxychloroquine and about how to test and about the data and the numbers, what's going on with 4,000 units or 4,000 ventilators going here or masks going here and how many we have. And I think at this point, being a small business owner and also being a citizen of the country, I don't know about other folks, but we're pretty well done with that, and that's good information. But we're all moving towards the what's going to happen in the plan to open our states, and how soon that could possibly happen, and what the impact is of things like hydroxychloroquine and the other drugs on the speed of opening the state.
Thank you for your call today, and I think I'm going to let Dr. Bell talk to you about the testing first.
Well, the testing really is a difficult one because the availability of the test to see if people are sick is an RNA test. Basically, what they're looking for is the presence of the virus itself, and that's most of what we've heard so far when people talk about testing, and we don't have near enough of those tests. They're just not available. So the people who are getting tested, by and large, are people who are really sick. That's why one of the things that folks are asked to do is, if you're sick but you're doing okay, stay home. Because the last thing you need to do is get somebody else sick, and it could be that you've got something else and you don't have COVID-19, and you don't need to get it if you don't have it. So there is that. But in terms of getting back to normal, that's a different test we're looking for. We're looking for an antibody test. Really, we want to test people to see who has run into this thing and who's immune to it now. And that's a different thing, because there are a lot of people out there who have run into COVID-19, may have been completely asymptomatic, may have thought they had a cold, may have had some symptoms, but now they're immune. And those are people that were fortunate enough not to get sick, but they're not going to get sick now either, because their immune systems have done the job that they were created to do. So when those tests become available, then we'll be much more comfortable at saying, hey, you folks can go back to work, you're not in danger. But as far as to when those are going to be available, frankly, is anybody's guess. Apparently, they're beginning to come online, but that's going to take a huge amount of effort from organizations to get those out to people, and we're very early on in the game right now, and I don't think anybody at this point knows. I hope that's helpful.
So it is helpful, but with a follow-up question, thank you, Doctor. I think what I'm hearing between the lines is we can open these states when we get better at testing, and the tests aren't available, which kind of scares me a little bit. The other question I have is you've taken a lot of folks, everybody in our state and other states, and we've sequestered in our homes and we've not gone out. And, we're a couple that has adhered to all that. But when you take the mass of people in the country and put them in their homes and sequester us, what if my wife and I never got the virus, never got near the virus, and we'll never get sick? We don't have any antibodies. We're susceptible to the virus we come out. So if, let's say, 50% of the country got put away in their homes quick enough, and that isn't the right way to say it, in our homes quick enough, and we come out and we're not, we just haven't had the virus. So what kind of risk does that impose to the country and to opening the state? And that could just create another real mess.
If I could jump in there and try and get that second part of your question about reopening Michigan and reopening our businesses, the Senate now has created a work group, a nonpartisan, bipartisan work group to look at that very issue, because what we're recognizing as the curve starts to come down, there is certain parts of the state that doesn't have a serious issue with the virus. So why not open up those parts of the state and get people back to work? Also, there's a lot of issue with who can't work, such as greenhouses and florists. Those type of businesses that don't have a lot of contact with people. And just yesterday, the governor agreed, and I pushed very hard on this, to allow auto dealers to sell cars over the internet. And there's lots of businesses that can do the same thing that should be reopened, so we can get our state back to work and get businesses, viable again, which is going to take time, and we better have a good plan in place to get that started.
Yeah, and I know these are hard questions with difficult answers, and I bet everybody on the line understands that, and I get it. I mean, if you took a couple states in upper Michigan or counties in UP and opened them up and quarantined those counties to keep people in them and don't travel around and people into them, I can see how that could work. But anyways, I'll turn it over to somebody else. Thank you, both of you, very much. It's so appreciated. Bye.
And Gary, thank you for your call as our Tele-Town Hall meeting with Senator Dale Zorn and Dr. Stephen Bell continues. If you would like to ask a question, all you need to do is press 0, and that takes us to William, who's calling in from Dundee. Hello, William. You're on with Senator Zorn and Dr. Bell.
Hello, gentlemen. I appreciate you taking the time for this. My question deals with the governor's message yesterday and the people that she's still eliminating or adding to the list who can't work. You can tell people they can go outside and walk around town, walk neighborhoods and everything, but contractors who for the most part are working by themselves or not in close proximity to anyone else, they can't go out and work. Now you have a lot of small towns that hire contractors to maintain parks and just help beautify their town. Now, William, if they can't go out and cut, yes.
So, William, you're absolutely right. And yesterday with this new order, the governor has prohibited families to dine together, especially on this holiday weekend. I'm sure there's families out there with planning family get-togethers. And with this new order, they cannot do that. I think the orders are going too far, and as we start to see the numbers come down and that curve come down, we should be opening up our state again. And there's no reason why we can't do that, because I think everyone needs to take individual responsibility for themselves. And I think there's been enough news out there and enough information out there that people understand that they should not get too close to people and wear a mask when you're out in the public. But the fact is, it's still personal responsibility, and we need to get people back to work. And we do have to do it in an orderly fashion, and that's what the Senate is currently working on. And I think we'll have some recommendations for the governor probably by the first of this week.
Well, that would be good.
Today. But I think the time is here that we do reopen the state and get it moving again. Yeah, a lot depends on it. You know, without people working, they don't have the revenue, the income to provide for their family, and governments don't have the revenue to provide for the services that we do. So it's a big circle, and we need to get back and get people working.
Yeah, I'm not saying we can just, open everything up. We can't, and I understand that. But part of our order yesterday, families aren't even supposed to get together. I've got a grandson who, his father, my son, and my daughter-in-law both work in the medical field. My daughter-in-law is an ER nurse, and I worry about her all the time going in. She's about 7 months pregnant, and she still goes to work every day. But now with both of them working, my son works in the medical field also. Who's supposed to take care of their 7-year-old? If my wife was reading the order right, we need a court order to be able to take care of him. That's just utterly ridiculous.
It is, and I think the governor should be getting phone calls on these orders, and I suggest everyone out there get a copy and read this order, and you will see that a lot of the things that we have been doing based on previous orders are no longer prohibited. And I've already started hearing about businesses that have been cited because they've been providing internet sales, lawn services that's been cited because they've been out cutting grass. And it's just, I think the governor has just gone way too far in this. So thank you for calling. Appreciate it very much.
William, thank you. Senator, thank you. Let's go to Janice right now, who is calling in from Erie. Hello, Janice. You're on with Senator Dale Zorn and Dr. Stephen Bell.
Hello. I have a couple of questions, medical. If a person tests that they have antibodies, well, that should prevent other people from getting it, or will they still be carriers on their hands, of course, but the body? Would their body still be, could it be a carrier of the virus even though they have the antibodies? And if they do the test for antibodies, then these people could have a written order, they're free of, they have antibodies. So that might be a way to trigger who can go out if we all get tested and see if we have antibodies. Could I have a doctor speak on that, please?
Sure, I'd be happy to. When we get sick from a bacteria or a virus, our bodies will fight whatever it is off and usually create antibodies to it. Those antibodies start to spool up while we're sick. So the presence of antibodies doesn't necessarily mean we're well. It means that your immune system's kicking into gear. Now, after we get back to normal health and strength, those antibodies persist sort of as a memory. So the next time we run into it, our immune system already has a leg up on knowing how to kill it, and we're essentially immune. That's what vaccines are all about. So if someone is well, they've gotten over it, they're symptom-free, we're not sure how long people can still shed the virus once they're symptom-free. That's why 2 weeks is tossed around, like one should self-quarantine for 2 weeks after exposure or 2 weeks after symptom-free, because we just don't know. But your question about once those antibodies are present and you've been back to normal and we have some confidence that you're no longer shedding the virus, those folks are immune. So theoretically, they could go back to work, and testing for that immunity may end up being a very important part of what it takes to get folks back to work.
And what about being a carrier? Will that eliminate being a carrier?
While you're sick, you can certainly carry it. One can be asymptomatic and carry it. But once you're well, once your body's dealt with it, we don't have any data to suggest that people can be carriers for this. Once you're done with the infection, now you can have an asymptomatic infection, so theoretically I guess you're a carrier, but you can have an asymptomatic infection for a time, but that doesn't seem to be a chronic state that goes on. But once you fought that off, and you don't have any active virus left in you, then you're immune, and you're not going to give it to anybody else. Now, mind you, you did say in your question, yes, if somebody else coughs on your hand or coughs on you, and then, could you carry it on your skin or your clothes? Well, sure. It's not like that immunity, radiates away from you. It just means that you're not going to get sick because your body knows how to kill it off. I hope that's helpful.
Janice, thank you for the call. Thank you, Doctor. Our next question is going to come in from Chris in Monroe. Chris, thank you for joining our Tele-Town Hall.
Thank you. I appreciate it. First of all, hey, Dr. Bell, it's Chris Essex. Unfortunately, I don't have. How you doing? Unfortunately, I have a question directly for you. This has been something I've been a little bit frustrated with Governor Whitner since day one with her edict and stuff like that. And I fully understand what she's trying to do and stuff like that. But I believe that there are things that could be done to get people back to work, like the carpentry in homes, and everybody's talking about the landscapers. These people are distant from the general public. It's not like they're getting in groups of 10 or groups of 1 or anything. They're by themselves. They don't have to have any interaction with anybody. So I think she's not thinking outside the box when it comes to that. And to me, if she was really wanting to battle a lot of this stuff, I take the things like that where the people are getting together, and I look at where, because I go out there like everybody else, and I've seen changes that have come about, which is good that she's throwing out there, please do this, please do this. I used to go into Meyer, and I would be one of 10 people out of 50 walking around with gloves and or a mask and stuff like that. Now when I go into stores, I'm seeing quite a few more people do it, which is good. But to me, honestly, like the restaurants, these grocery stores are now the hot spots for the transference of the viruses between one another. You say like you got your asymptomatic people that go in there, things like that. to me, that's the new hot spots. And honestly, I think if they were to analyze it and come up with a methodology, they should be able to come up with a means to make going into Meijer and Walmart and everything else like that a curbside type of service. That way you avoid the contact with everybody. And then also along those lines, you can actually employ some people to go into the stores and start filling a request for people who are outside. Because I know I've heard right now, like if you go to order something from Kroger that you used to be able to do and get it within a day or get it that day, it takes you up to 5 or 6 days to get it because their ordering is so backlogged and stuff. So, you employ people doing that. I understand that, I watched her thing the other day and her comment to everybody was, they can go out and these carpenters or these landscapers and touch the gas pump. Well, like I said, I see everybody's getting smarter about that. I wear gloves when I touch the gas pump. I see more people doing the same thing. So that's really not an excuse anymore. I'd have been embarrassed saying something as simple as that, but that's not me. But,
Okay, Chris, thank you, Senator, Doctor. Obviously a lot of issues at play in this situation.
Yes, I believe that you're right on all sides of it. I think people have taken some very good personal responsibility, and they understand how important it is to protect themselves. And that's probably going to have to happen well into the future, even after that curve decreases, because it will take time for the virus to die off.
Senator, thank you. Right now, our next question is coming in from Joanne in Adrian. And Joanne, you're on with Senator Dale Zorn and Dr. Stephen Bell. Are you there, Joanne?
Hello.
Hi, Joanne. Welcome to our Tele-Town Hall.
Hi, thank you. Can you hear me?
We can hear you.
Okay, here we go. Mom, they want your question. Here.
I see that from a graph that Michigan has quadrupled the cases of the virus that Ohio does. And I do remember the governor telling doctors and pharmacies that if they fulfill the prescriptions for the medication, that their licenses are in jeopardy. I wonder if this is a contributing factor to the fact that Michigan has so many more cases than Ohio. Thank you.
Yes, it absolutely could be, because it took so long to start using the drugs here. And then after the governor told our doctors that not to use it, and if they did, they could lose their license. I think that put us way behind the curve, and is part of the problem of our high number of viruses. So I think you're absolutely right, and I'm thankful that finally the governor has decided to listen to President Trump and get that drug out there for those that need it.
Hey, Senator, thank you. Our next question is coming in from Samuel in Monroe. It's a question for Dr. Bell. And Samuel, welcome to our Tele-Town Hall. You're on with Dr. Stephen Bell and Senator Dale Zorn.
Hello, gentlemen. The Center for Disease Control finally gave us a number for the R0 for the disease, and it's 5.7. That's very high. And we are going to be, we're probably going to need very high density of people either vaccinated or already going through the disease and have an immunity to the disease before this thing, before really what we do can return to normal. So can the doctor speak to that, please? Because we didn't do anything correctly in 1918, the last time we had a major outbreak like this. And that swine flu came back 3 times in America. So, doctor, if you could you address that, please? Because that's a very high transmissibility index.
Sure. Well, the bottom line is vaccines that are both safe and effective take a while to work, or take a while to develop, and there's a whole lot of effort being put into that right now. How long that's going to take is really anybody's guess. There's a lot of promising things that they're talking about, but how long it's going to take to actually come to you and I is really anybody's guess. And no one really knows if this is going to be one of those things that comes back multiple times or just ends up being one of the many viruses that we deal with as human beings. Nobody really knows. That's the honest truth of it. And unless one has a crystal ball, no one's really going to be able to tell you any different. Time will tell, and there's a lot of studies going on, and more data will come out as time goes on. But for right now, it's a good question for which I have no good answer.
Thank you for that call, and thank you, Doctor. Our next call is coming in from Scott in Ida, and Dr. Bell sounds like Scott wants to talk to you too. Hello, Scott. Thank you for joining our Tele-Town Hall.
Well, thanks. Two questions, one for Dr. Bell and one for Senator Zorn. Dr. Bell, what's the doubling rate of this virus in Monroe County? That's number one. And number two, same to you, Dr. Bell, is yesterday listening to a Tele-Town Hall for Kent County. They indicated they're testing up to 1,000 people a day, and you kind of indicated that's not the case in your area. So that's that. And Senator Zorn, you made a scary comment in your opening statement where you said that the governor may come out with more restrictions prior to April 30th. So one of you gentlemen go first. Number one is doubling rate in Monroe County. That's one. And why so limited testing in your area, Dr. Bell? And then Senator Zorn, what other things can we expect based on your opening statement? I mean, this governor's out of control. She's way out of control. So, gentlemen, please.
Go ahead, Doctor.
Sure. Well, very briefly, what's the doubling rate of the virus? To be honest with you, I really don't know. And I don't think anybody does, because most people who have this are asymptomatic. So what's really out there, I mean, what you see, any numbers that you do see is the tip of the iceberg with a whole lot of iceberg underneath it that you don't. And so any number that you're going to see doesn't give you the clearest idea of what's really going on. As to why there aren't more tests out there, well, it's a matter of availability and manufacturing them and all these other things. If people had seen this coming, months and years in advance, it could have been maybe different, but we have what we have, and it's just kind of the way it is.
On your second part of the question, in this order that she just did yesterday, she has in there that families cannot get together for visits, for dinners. There looks to be a crackdown on businesses that are open, such as floral shops and of landscapers and that sort of thing. I have already gotten reports that there has been several in Monroe County that has been stopped by law enforcement, and there could well be some prosecution coming because of her orders. And she gets this authority. I want to make this clear. She normally doesn't have this type of, the governor doesn't have this type of authority, but in this case, the Emergency Act that she is using gives the governor very, very broad powers. And she can nearly override the Constitution, and in some cases that has already happened, especially by prohibiting your movement. So there's a very tight rope there that's being pulled on, is your constitutional rights and what she is prohibiting people to do at this time. I think this has to be a very good history lesson in just how quickly government takeovers can happen.
Senator, thank you. Right now we're going to go to Mary, who is calling in from Adrian. Mary, thank you for joining our Tele-Town Hall.
Hi, this question is for Senator Zorn. I just read on the updated email that I get every day from the Chamber of Commerce here in Lenawee County, and it said that you were looking for input on the, how to get back to work. And so my son is a self-employed landscaper, and I get what the governor is saying about they don't want more people out than needs to be. And I get that they shouldn't be doing, starting a new paving project around your back porch or whatever. But can we suggest to the governor maybe some guidelines to follow, like no entering the house, no more than one person in a landscape vehicle, because the grass is going to obviously start to grow for older people or businesses who don't have a mower and now cannot buy one because those stores are closed to us. And so, you're going to have West Nile virus concerns for standing water. And so I would wonder if we could bring that up to the governor with some guidelines to follow. I get that they don't want everybody going out to buy flowers and and being in stores for that, but just the lawn mowing and maintenance that can be done by one person in a vehicle by themselves, where they're not entering the business, they're not entering the house, and there's, like I said, the concern of West Nile virus concerns for standing water, with the lawns getting bigger for businesses and for older people, they can't even buy a mower. And so that maybe could be something that could be brought up?
It has been brought up. We have been bringing those issues to the forefront. Auto dealers is one that I've been working on. We just got that settled yesterday. The governor agreed to my position that at the very least, auto dealers need to be selling cars over the internet, and she has approved that. There is so many more industries and businesses that could be open and people could be working where they don't have contact with the public or contact with people. And they can always make policies, company policies, to do that. I trust Michiganders that they're going to do all they can to protect themselves and to protect their customers and the public. We have to get by this power that the governor seems to have, and get people back to work. I think the governor's gone too far on these orders, and we need to pull back on them. But unfortunately, the governor does have the very broad powers of the Emergency Act to do what she's doing.
Right. But I just wondered if guidelines could be set for companies like that. My other question is, if you're self-employed, when does the unemployment open for you?
It should be open now.
It is today.
But I have to tell you that it's a slow process because they're having trouble with computer shutdowns and just the vast amount of people applying. As of this morning, we've had 817,000 people who've applied for unemployment. But for businesses, there's quite a number of business relief programs, especially through the CARE Act, paycheck payment protection, There's just a number of them, which the longer you wait, the longer it's going to take for you to get relief. And these programs are good. What I have seen, the programs are easy to apply for, and it doesn't take very long to receive some financial help. And most of the time, probably 95% of the time, this type of help is forgivable as long as you follow the rules and the policy that they have. You would be able to have the loan or the grant forgiven.
Senator Zorn, thank you. Obviously, a lot of moving parts right now when it comes to unemployment insurance in Michigan, especially when it comes to self-employed people. A lot of questions there still. Right now, we're going to go to Rosalie, who is calling in from Monroe, with a question for Dr. Stephen Bell. Hello, Rosalie.
Hi. Yes, Dr. Bell, I realize that probably this is a question that we can't answer, but I was wondering about herd immunity. If enough asymptomatic people have had this and we go into a second peak, is there any way to tell if the herd immunity will lessen it? Because people who are asymptomatic and have been out in the community taking care of everyone or whatnot would have exposed enough people to, there's no way to tell without the antibody test, in other words, I think, if the herd immunity would be benefit us.
I get what you're asking. It's a good question, and I have to say again, it's a good question without a good answer. Herd immunity is just that level of immunity needed in the population so that the virus is not able to continue, and then the epidemic dies out. It's a good question as to what that would look like. Frankly, nobody knows, but that's certainly a question on everybody's mind.
Rosalie, thank you for that question. Senator Zorn, Dr. Bell, right now we're going to go to a question from Nick, calling in from... Well, it looks like we have some issues with the call from Nick and Adrian. But Dr. Bell, he was basically asking about hospital capacity in southeast Michigan, Monroe County, Lenawee County. Any insight on that?
Well, it tends to vary. In some respects, it's very, very busy, but in others, it can be empty because folks aren't going to the hospital for anything else. So depending on the hospital, depending on a whole lot of things, sometimes they're surprisingly empty, sometimes they're bursting at the seams.
Thank you, Dr. Bell. Right now we're going to go to Scott, who is calling in from Adrian. Scott, thank you for joining our Tele-Town Hall with Senator Dale Zorn and Dr. Stephen Bell.
Hey, Senator, thanks for taking my call, and I wanted to say thank you for your representing us in this capacity, and really appreciate the town hall. I had a few things. A lot of them have been answered just listening to the town hall. I got dialed in a little bit late, but it seems to be that through this executive powers that the governor has, is there any limit? Is she only limited to what applies to this, or does this give her a free rein to make any type of executive orders that she wants to get her own agenda done?
It's pretty much she's open to do as what she feels needs to be done. And again, I think the governor's gone way too far what's happening today.
Senator, thank you very much. Right now we're going to go to Jerry, who's calling in from Morenci. And Jerry, you're on with the senator and the doctor.
Yes, I'm pastor at Canandaigua Church. We have a small congregation. I mean small. We got the seating capacity in there for between 90 and 100 people. We have maybe 15 to 18 on a Sunday morning, counting myself. I personally don't see why we should have a problem with being able to meet on Sunday morning. And all these people are 60 and older. I myself am 78, but these people would have no problem keeping the distance. But yet we all go to the grocery store, and we cannot keep that kind of distance between people at a grocery store.
Yes.
So we're at a risk going to buy groceries than we ever would be going to church.
Yes, I understand what you're saying, and I think that's one of the problems that the governor has created is winners and losers, and I think there's a lot of discrimination going on between her executive orders. I understand exactly what you're saying with a church. You can spread the people out in your church, and they probably will have even more than 6 feet, which is sad. But I understand very much what you're saying, and I believe First Religious Institutions is somewhat protected. But the issue with how many can be congregated at one place is really up in the air for interpretation. I hope you have church and you exercise that right.
Senator, thank you. Our next question comes in from Keith in Adrian. Hello, Keith, and thank you for joining our Tele-Town Hall.
Yeah, thank you for having me. We own a small business. It's a hot dog cart. Okay, it's not a trailer or anything like that. It's something like you'd find in the parks, like in New York or whatever. And are we going to be able to work or not? And because of the way things are going now, we only have a 3 or 4 month window to work in, and this is eating fast at our window of making any money.
Well, Keith, that's really a good question. I haven't heard that one yet. First off, I would say that you are a takeout business, so you would meet that criteria. I just don't know what the governor would say to that. So what I'm going to do is I'm going to give you the governor's phone number, and you can ask her that yourself.
Okay.
Or at least someone in her office. And I believe this number is still good, but I'm sure it's probably it's probably busy. But that number, 517-335-7858.
7858. Thank you. I got one more statement to make. I think maybe we should all learn from this and quit buying in China and buy American made. We probably wouldn't have had this stuff as bad as what we got it now if we'd have been buying American made products. And that's just the way I feel. I don't buy anything hardly at all made in China anymore. I haven't for years.
Well, thank you for that thought. I'm with you 1,000% on that. Let's get Michiganders and Americans back to work and become self-reliant on ourselves and not some other country.
Thank you, Senator. Our next question is coming in from John in Tecumseh. And John, you're on with Senator Zorn and Dr. Bell. Are you there, John? John in Tecumseh, are you there? Well, we might, let's try this one more time. John in Tecumseh, there you are.
Hello.
Welcome, John.
Yes, thank you, both of you, for holding this town forum. It is a critical time in our nation's history. I so appreciate Senator Zorn pushing back against this seemingly heartless authoritarian decisions by the governor that make me question all of her motives. They just go to the heart of the issue of violating rights of assembly, and the cure being worse than the disease. I'm wondering what thoughts the senator has on giving timetables for when people can get back to work in various capacities so that they have that hope that comes from that. And I also wonder what the doctor thinks on the CDC recommendations that have been, their models have been very skewed and amazingly off in their guidelines for how doctors are to write death certificates are terrifying in terms of the statistics and how that impacts the statistics being represented by the coronavirus. Thank you.
Thank you for that question, and I'll jump in and tell you that that's the big issue that we should be working on now. We should have started this weeks ago, is determining how we reopen Michigan and how we get our Michigan businesses moving again and getting our employees back to work. You know, I think there's several different ways that we can do that. I think we should absolutely look at those counties that have very little virus problems. We do have some in northern Michigan that still doesn't have any cases of virus. We have to allow these businesses to create their own policy to allow their employees to remain safe and their customers to be safe when they come in. But I think there's a lot to say about personal responsibility, and I just have to believe that people that have been listening to the news for the last 3 weeks absolutely know that this is dangerous. It's not a good situation. But like any other disease, we can take precautions, and I think we can do that, and people are doing that today. But we need to make sure that we get our people back to work, make them relying on themselves so they can feed their families and pay their bills. This can't go on forever. And I'll end this, and I don't know if Dr. Bell has something he wants to tell you, but I'll end this with you by saying that let this be a lesson in history that a government takeover can happen pretty quick and without firing a shot. Dr. Bell?
I really don't have much of a comment on that. I think it's one of those things that is going to take time to figure out what we did right, what we did wrong, and was the cure worse than disease? It's a good question, and it's going to take time to sort out. It certainly is one of those things that, depending on what your livelihood is and how close you are to it, and that you can have strong feelings about it, very valid strong feelings about it all over the board. So it's certainly a good question.
And Dr. Bell, Senator Zorn, we're starting to wind down now to the end of our hour, and we have time for maybe one or two more questions, and that takes us to Kathleen calling in from Carlton with a question for Dr. Bell. Hello, Kathleen.
Hello. I actually have a couple things to say, but Dr. Bell, about 5 or 6 years ago, I come down with a virus, which I thought was just the upper respiratory, the nose, and everything. But it hung on to me for almost 3 weeks, and it kept coming back. I had a fever, and then my nose and the sinuses and everything, and then it would go away for like a day or something, and then it would come back. Well, when I finally got over it, I didn't have any taste, and my taste and smell was off. I went to an ear, nose, and throat doctor specialist, and he come in and told me I had a virus, and the virus killed my taste and smell. Is this virus the same thing as what is going on now? And if it is, would I be immune to this COVID-19? And how can I find out?
Well, you ask a great question. Here's what I can just share with you what I know. I know that the SARS coronavirus, this is, the SARS CO-2, because it's the second one we've really ran into. The first was what we know as SARS, that was prevalent north of us for a short period of time, but really didn't get the steam behind it, or I should say the wind behind it, that this one has. It did a lot of the same kind of things, including the loss of taste and smell. Some folks very briefly, some folks for quite an extended period of time. Doesn't really relate to this particular one, so far as I'm aware. That there's no immunity that, you have one, you're immune to the other. That does not seem to be the case. But could the viruses have been similar? You would start to wonder that it may be, but it's really anybody's guess. And your immunity to anything is going to be dictated by having antibodies to it, and getting tested for those antibodies will tell you what's already happened. That I'm aware of, there's not an antibody test to SARS that's widely available, but they are coming out with one for the COVID-19, and that should be widely available at some point, hopefully very soon.
Okay. All right. Thank you very much. I appreciate that. And Senator Zorn, I'd like to just make a comment about our governor. She's out of control. And I think the people of Michigan need to do something about the power that the governor has. As far as I'm concerned, she's out to destroy as much as she can, and then she'll want to bring it all back. It's a political play. And I think it's disgusting and repulsive that our governor is behaving the way she is.
Kathleen? Thank you, Kathleen. I believe this broad power she has is she's taken completely out of control. I agree with you, and I would like to think we could get the Emergency Act amended to correct this situation, but I'm almost certain she would not sign it. So it may have to wait till we have another governor before we can do that. But in the meantime, I assure you that I will be working towards making sure that people can get back to work and provide for their families again.
And Senator, thank you very much. Right now we're going to go to a question coming in from Carol in Lambertville. Carol, welcome to our Tele-Town Hall.
Yes, this is Carol Hansen from Lambertville, and I was wondering how many cases are down here in lower Michigan by Toledo. I know they say Monroe County, but I don't know. Monroe County's big, and I was just wondering how many cases really were down here by the line.
Carol, Carol, I don't have a number. I take that back. I've just been given a number by one of my staff members that there is 20 in the Lambertville area.
20?
Yes.
Okay, that gives me more of a idea of what we're dealing with. And I thank you very much for this call.
You're welcome.
And take my question.
You're welcome. Stay safe.
Carol, thank you very much. And as we come down now to the end of our hour, Dr. Senator, maybe to summarize, as a medical professional, as a Michigan State Senator, what's your advice, what's your input on what people should be thinking and doing as we move into the days ahead? Doctor?
Well, there's really two things. Number one, stay safe, stay protected, wear your masks. A lot of we've heard time and time again to wash hands. Make sure those hands are clean. 20 seconds. Don't touch your mouth and nose with unwashed hands. It's a very difficult thing to do, but we've all got to try to do it because these basic things will keep us safe. Staying away from sick folks. If you're sick yourself, stay home. But then the other thing is to make sure that you can reach out to as best as you can to others, because our mental health is important, and it's important to reach out to friends and family electronically, as we're able to do the most of us with either telephone or other things like FaceTime or Zoom or whatever our electronic capabilities are, but also to remember those folks that maybe aren't as fortunate and are shut in, that we can reach out to them at least electronically with a telephone and stay connected. It's important to stay connected to other people because when this is all said and done, we're all people, valuable human beings, and we need to have that connection with others to be able to live happy and fulfilled lives. And these are tough times. We need that connectivity, even if it's not face-to-face.
Senator Dale Zorn.
Thank you, and thank you, Mr. Perry, for moderating today, and to Dr. Bell for being a part of this Tele-Town Hall meeting. And I especially thank those that called in. I have to say that we had at one time 183 people that was listening in. It was the largest Tele-Town Hall I've ever been a part of. And I know that there's more questions out there. I think we will probably look at maybe doing another Tele-Town Hall, but in the meantime, if you have any questions, you can email our office at sen, SEND, at senate.michigan.gov. Again, that is SENDZORN at senate.michigan.gov, or you can call our office at 517-373-3543. And again, I'd like to thank you all for stopping by to this meeting today, and wish you a very happy Easter, and ask that you stay safe and healthy, and help me get this state back to work.